Hi guys, welcome back to my channel. It's Della and I'm back with another video. If you are new, you're most certainly welcome. So basically today I want to talk about ways to decide if respiratory therapy is for you, because I know some of you are probably taking your prerequisites, and the prerequisites are kind of similar to those of nursing. So if you're kind of wondering if respiratory therapy is for you, I kind of have like a few things for you to think about before you decide on what you want to do or if this major is for you. So with that being said, let's get right into the video. So basically, like, of course you guys know I have my phone because I always have to look at my phone to so I don't forget anything that I want to talk about. So if I'm looking down, you guys probably already know by now, it's because I'm looking down at my notes on my phone. So basically the first thing I would say for you to think about whether this career is for you or not is to write down like the pros and cons of respiratory therapy. So you know what that is. You divide your paper into half, pros over here, cons over here. And you should also think about, while you're writing down your pros and cons, you should also think about finances. Like, are you going to work while you're in school, or are you just going to go to school full time? Those are kind of things you should be thinking about while you're writing down your pros and cons. Your work schedule. So is your work schedule and your school schedule going to go together, or are you going to make changes on your work schedule? Are you going to have to drop a few hours because you're not going to be able to work full time anymore? You should also think about the years it'll take you to get your degree. So basically, you can get your associates or your bachelor's in respiratory therapy school. You can decide on whether you want to do a 2-year degree or a 4-year degree. As you guys already know, I'm doing my bachelor's in respiratory therapy, so my program altogether is 4.5 years. So another thing you should think about doing is volunteering, you guys. So if you really want to know if this career is for you, it's for you to volunteer at a couple of hospitals around your area, and ask them if you can shadow an RT for a day or so you can get an idea of what respiratory therapists do, instead of just diving into the program, and then you get in there and you're like, well, I don't want to do this is not what I want to do. So don't waste your time, go volunteer for a day or two and just shadow an RT. I think hospitals will allow you to do that if you ask. Shadow an RT for a day or two so you can see what they do on a daily basis. Another thing is, are you doing RT simply because you want to help people? A lot of people go to college thinking, I want to do something where I can help people, and they only think that working in a hospital environment is the only way they can help people. If you're somebody who cannot deal with bodily fluids, you cannot deal with blood, you cannot deal with sputum, you cannot deal with any of that, I don't think this career is for you. You should probably think about doing something like, I don't know, social work. There are so many careers out there that people can do for them to help people. You don't have to be in a hospital environment, especially if you don't feel like it's for you. Just like nursing, respiratory therapy isn't for everybody. So think about that before you just dive into it, because I know a couple of people who went to nursing school because they want to help people, and they really don't like nursing because they don't like bodily fluids and stuff like that. And you cannot be a nurse or an RT without dealing with bodily fluids. So it's something you should think about. Another thing is, do I want to do respiratory therapy because of the job security? So obviously, in the medical field, job security is the main reason why some people would go into working in the medical field. And that's not the main reason you should go to school to do something. You should go to school to do something because you love it. Of course, with experience comes job security, the years of experience you have, the easier it is for you to get hired at different hospitals and stuff like that. So there's always going to be a job in respiratory therapy because people are always sick. So you don't want to do this just because you feel like you're doing it because of the job security. You want to do it because you love it. Because honestly, if you're just doing it just to have a job or something like that, you're going to be miserable. I promise you. Another thing you should think about is, am I willing to serve others? So like nursing, respiratory therapy is about serving other people. You cannot be selfish in this field. Like you just can't, because people's lives are at stake. There are sick people who are going to be needing help. So if you think that you can be selfish and be an RT, newsflash, you cannot. You have to be able, you have to have the ability to put other people before yourself. You cannot be selfish, because from my experience from going to clinical, there are days where I would be standing for a long time. Sometimes you're going to be standing for a long time, and sometimes you are not going to be able to have your lunch break because something is happening. Like, you think you would fix a problem and then something else would happen and you have to attend to that patient. So sometimes you're going to miss out on your lunch break, and you're going to miss out on like not having a break at all. You're going to be standing for a long time. So you have to like think of these things, like, am I going to be able to put other people's needs before my own? And I think that's like one of the biggest thing you're going to have to think about if you want to be a respiratory therapist, because like I said, you just can't be selfish in this field. You have to like be selfless, not selfish. So yeah, and you have to also think about, why do you want to do this? Do you want to do this simply because somebody is forcing you to do it? Because I know some people, their parents are paying their tuition and they're telling them to major in certain things and stuff like that. So you can't do something because somebody's forcing you to do it. You have to do something because it's truly what you want to do and you're very passionate about it, and you like simply just want to do this for the rest of your life, and you just are going to love everything about it, the good, the bad, and the ugly. So if you're doing this because somebody is like paying your tuition or something like that and they're forcing you to be in the medical field, you're not going to like your job. I'm sorry. The next thing you should think about is, are you open and willing to work long hours and overtime? Because I think you probably already know that it is 12-hour shifts, so the hours are pretty long. So are you willing to be able to be in a work environment with different members like of the hospital for 12 hours? Are you willing to work overtime and holidays, because there are times where you're going to be working holidays and overtime, and you have to think about stuff like that. So if you can't work long hours and overtime and holidays, maybe you should look at other options. Last but not least, and I think this is very important too, are you good at teamwork? So basically, you cannot be selfish and be a respiratory therapist. Like, it's just not going to work. You cannot be a loner, or you cannot be someone who cannot work in a team and think you're going to be a respiratory therapist, because there are going to be so many people you're going to have to work with in the hospital, not just like other RTs, but you're going to be working with nurses, doctors, physical therapists, speech therapists, different peoples, and you're going to have like people skill in general. Even when you don't want to like deal with people, you're going to have to. So you can't, think you're going to do your own thing in a hospital and it's going to be, okay. It's not going to be okay. You're going to have to learn to work in team. If you're not a team player, you should probably think about doing something else. You should probably think about doing something else, because I don't think respiratory therapy might be for you. Because honestly, it's like teamwork makes the dream work. I know it's like elementary school, but it's the truth. Like, you're going to have to learn to work with so many different people, so many different personalities, and you're going to have to learn to deal with these personalities. And I know some people can't handle that, but it's just something you're going to have to do. and you just can't think you're going to just do your own thing and not listen to anybody and just do what you want to do. You can't do that because, like I said, people's lives are at stake. So you can't just do your own thing. You have to listen to people. You have to work in teams. You have to, discuss things with people. So if you can't work in teams, maybe you should look at something else. And I hope this helps. And honestly, I think that's it for this video. And I think those are a few things that I find very important that you should think about before applying to respiratory therapy school. And I will talk to you guys in another video. Thank you for watching. Bye.